The spinal cord acts as the central hub for the nervous system. It carries nerve signals back and forth between the brain and the rest of the body. It needs energy to transmit the message all the way down to your toes, especially for taller individuals. And any imbalance in this process can lead to some devastating effects.
So if you have too much blood sugar around, the nerve becomes unhappy. It's like having too much waste and it can't function normally. Too many lipids, too much waste, it causes oxidative stress. These little powerhouses or mitochondria up here no longer travel down to the tip of your toes. Your toe nerves have no energy, and so they quit functioning. And slowly over time, they wither and die, literally.
Which is what causes peripheral neuropathy. Dr. Eva Feldman is the Russell N. DeYoung Professor of Neurology at the University of Michigan. She's one of the world's leading authorities on neurodegenerative disease. But when she first established her lab more than 30 years ago, she was advised not to focus on neuropathy.
I was told, Dr. Feldman, please don't do neuropathy. It's not common enough. It's really somewhat too rare. No one's going to be interested in it. And now, as you know, 50% of individuals, nearly 50% have neuropathy who have any aspect of the metabolic syndrome because we have grown. We are an overweight, much more obese nation than we were when I first started.
There are different types of neuropathy, but peripheral neuropathy is estimated to affect more than 20 million Americans. It occurs when the nerves stop getting enough energy to work and begin to die, causing a loss of sensation and function.
Peripheral neuropathy is a very slowly progressive process of loss of function in your sensory nerves. And it usually starts in your very distal toes and over years will slowly progress up your leg until below your knee, and then it will end in your fingertips. The symptoms of peripheral neuropathy, what you as a patient feel, really can vary from person to person. Some people feel just numbness, but no pain. Many people feel fairly excruciating pain, and the pain also may come and go. Worse at night, worse if the feet are touched, worse if it's cold. But the symptoms can be so, I'll have to say, severe that if someone loses all sensation in their feet, they can step on a thumbtack and not know it. And have I seen that in clinic? Oh, yes. I pulled thumbtacks out of the bottom of people's feet because they did not know that they had stepped on one.
Feldman says the treatment and ability to reverse the damage depends on the type of peripheral neuropathy.
So one way to think of a sensory nerve is to think of an extension cord. And so that the nerve is the wire in the extension cord, but an extension cord also has insulation around it, as does the nerve. So the nerve is insulated, and that's known as myelin. And then the wire is known as an axon. So there are two different types of peripheral neuropathy. One is axonal, so it just affects the wire. And that is commonly seen in prediabetes, diabetes, and certain vitamin deficiencies, for example. That is much harder to treat, except for treating the systemic condition, such as diabetes, prediabetes, high blood lipids can cause it, thyroid disease, vitamin deficiency. You can also, though, have the wire working fine, the axon, but have the insulation known as the myelin become disrupted. When that becomes attacked or disrupted, that's known as a demyelinating neuropathy, loss then of the myelin sheath.
This type is often caused by autoimmune disorders and can be successfully treated where the patients gain back full function. But when the nerve itself is damaged, Feldman says usually the best they can do is to halt progression, not regenerate the lost nerve. Because of this, it's important to catch the condition early. However, there are often hidden obstacles to prevention and early diagnoses. Feldman was an author on a recent paper published in the journal Neurology that aims to identify these problems. The research, led by Evan Reynolds, looks at the risk factors for peripheral neuropathy and how they differ between races.
It's been reported in several studies that Black and Hispanic Americans have an increased likelihood of having neuropathy compared to white Americans, and we aim to answer the question, why?
Reynolds is an assistant professor of biostatistics and epidemiology at Michigan State University. The team wondered if this difference in increased risk was still present after accounting for factors like having diabetes, obesity, and high blood pressure.
What we found is that Black Americans did not have a significantly larger likelihood of having neuropathy compared to white Americans. And so what this likely means is that the increased prevalence that we see of neuropathy among Black Americans is likely caused by the fact that these populations have increased likelihood of having some of these risk factors that underlie the condition.
Which is helpful in knowing exactly what to target to prevent cases of peripheral neuropathy in this community. Unfortunately, Hispanic Americans didn't show the same outcome.
We accounted for as many known risk factors as we could, and yet they sort of maintain that increased risk of having neuropathy. And so we need detailed studies of larger populations of Hispanic Americans to figure out why that might be.
It could just be that there are risk factors the team didn't think of, or it could be an underlying genetic component to the condition. However, Reynolds does believe that a main factor driving this population's increased risk of peripheral neuropathy could be food insecurity. It's a factor that often leads to people choosing cheap calories, a decision that usually results in a poor diet. In fact, Feldman says that saturated fats is the real enemy to watch out for.
So those individuals who have a diet high in saturated fats had worse neuropathy in that paper. And that's a really important point because saturated fats are a very poor source of energy for the nerve. And the nerve is unable to really metabolize saturated fats by the mitochondria, the powerhouse, and turn it into energy for the nerve. If you are a patient and you are mild, that you are overweight, you have poor source of diet, you really don't understand what's happening to you. Like, why are my feet becoming numb? Why am I having pain? And if you can see a healthcare provider and have access to healthcare where that can be explained to you, and you can have a better understanding, well, I really do need to try to lose that 10 pounds or 15 pounds. I do need to make these dietary changes. I need to inspect my feet at night. Simple recommendations by healthcare providers really changes the long-term outcome of neuropathy.
Feldman believes that our nation's weight gain has had a big influence on the increasing rates of peripheral neuropathy in Americans over the last few decades.
So being overweight is a BMI between 25 and 30, and obesity is a BMI greater than 30. Currently in America, 30% of adults are obese, frankly obese, and another 30 to 35% are overweight. So we now have 60 to 65% of our population that carries a big risk factor for neuropathy, and that is obesity. And usually with that, hand in glove comes the prediabetes, diabetes, the high lipids, hypertension, so all the other risk factors.
Which is why diet modifications are a huge component to prevention.
I really believe that these healthy lifestyle habits can prevent a lot of these metabolic conditions, such as obesity or even type 2 diabetes. And ultimately, those conditions can then prevent the likelihood of having neuropathy. So if I were to implement a broad change, it would really be to increase our physical activity and improve our day-to-day diets.
Which means that this could be yet another application for GLP-1 receptor agonists. In fact, Feldman believes that these compounds will be complete game changers for the field of neuropathy.
The results are supposed to come out soon, where they're looking at the effects of the GLP-1 receptor agonists on brain health, independent of the weight loss, but also it's being looked at on nerve health, even independent of the weight loss. So, it could be two things. It could be not only losing the weight, getting rid of the bad saturated fats, returning energy to be more normal, being more eumetabolic, but there also might be a direct effect of this family of compounds on the nervous system.
And this is only the start of the research. While the information Feldman and Reynolds gained from this most recent paper is important, they were only able to pull data from 1999 to 2003. They pulled publicly available data from the National Health and Nutrition Examination Survey, which only assessed peripheral neuropathy during those 4 years.
It was a really cool opportunity to look at a large database, and now we're attempting to replicate these findings and hoping to replicate these findings using more contemporary data too. And one of the data sets we're actively using is the National Institutes of Health All of Us research study, which is a large, comprehensive electronic health records-based database of Americans.
This database gives researchers access to the demographic and health information of more than 800,000 participants, which Reynolds is hoping will help answer some of the lasting questions from his research paper. One area he's actively pursuing is looking at how someone's risk profile changes over their lifespan.
An example of this could be, is it really having obesity since you were 18 years old and having sort of a consistent risk throughout your whole life that's important? Or if you all of a sudden become obese when you're 50 years old, does that give the same amount of risk? We hypothesize that it doesn't. And so that's an active area that we're looking to explore.
You can find more information about Dr. Eva Feldman, Evan Reynolds, and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our executive producer is Amira Zavari. I'm Elizabeth Westfield.